Good morning, everyone. Thanks for joining us. For someone who has had a stroke, the chance of a second stroke within 5 years is as much as 30 to 40%. So what can you do to reduce your risk? Nurse practitioner Lisa Belling joins us from Gunderson Health System this morning with some tips. Good morning. Thanks for getting up with us.
Thank you for having me.
Why does one stroke put you at such a great risk for a second? Is it simply because of the risk factors that made you a stroke candidate in the first place, or does something change in your body after that first stroke?
When a person has a stroke, we look at modifiable risk factors versus non-modifiable risk factors. Non-modifiable risk factors would include gender, race, and age. But our modifiable risk factors, which affect so many health conditions that many people have, are diet, exercise, tobacco use, alcohol use. Those are all things that we can do to decrease our risk for a stroke.
And that's with the first stroke. What can you do differently if you've already made those lifestyle changes after your first stroke? Can you do anything in addition to those to reduce your risk of having a stroke a second time?
Well, if you've had a stroke and then you've changed all of those habits, you're greatly decreasing your risk for a second stroke. The other thing we look at is the treatment of high blood pressure, diabetes, high cholesterol. About 15% of all of our stroke patients have atrial fibrillation, and it's unknown. It's very asymptomatic. So after that first stroke, we are often able to identify that condition and prevent another stroke by treating that. But truly, if a person is smoking, has had a stroke, stops smoking, starts treating their high blood pressure, their diabetes, their health conditions, exercising, low-fat foods, they will decrease their risk for another stroke.
And of course, stroke rehab difficult. So for everyone out there, whether you've had a stroke or not, living a healthy lifestyle can help prevent you from having one in the first place.
Truly, it does. There are certain conditions or health problems that people have that we don't know when they have a stroke, and we can treat those and fix those problems, and then they again reduce their risk for a secondary stroke. Those conditions are relatively rare. About 40% of the strokes that occur have no known cause, even after we work them up and try to figure out what happened. So sometimes we cannot find a cause for the stroke, and if that's the case, we really just need to work on secondary medications to prevent another stroke, as well as continuing with a good, healthy lifestyle.
All right, well, Lisa Belling, May is Stroke Awareness Month, so we thank you for joining us this morning and talking a little bit about what we can do to prevent our risk of stroke. Thanks so much.
Thank you.